Hi, I'm Dr. Julie Nelson, and I am a doctor of traditional Chinese medicine here at Chi Integrated Health in Vancouver, BC. The one thing I see in my clinic, and I've seen over the years practicing as a doctor of Chinese medicine, is the impact of trauma on the body. And so when a body is in balance, it typically does not get sick. So it's when we're overworking, overeating, overexercise, overthinking, we deplete our body's natural energy. And if we continue on, we will get sick. So if we're overexercising, we're going to have muscles strained, pulled muscles, torn ligaments. If we're overeating, we're going to have obesity, digestive disorders, and overworking will become fatigued. And at some point, your body gives out and you get sick. So the reason I'm talking about balance is because what I've seen in my clinic is when patients come in with chronic health problems, and not just one, but many, it sort of triggers a red flag for me. And the reason I say that is because what I was seeing in clinic was an incidence of young women coming in who had multiple health issues. And one example I'll take, and this is her name, this is a pseudonym for her name, but Jenny. Jenny came to me last July. She was a 22-year-old student, and she'd returned home because of COVID. And when she came to see me, she had Hashimoto's, hypothyroidism, IBS, SIBO, which is a overgrowth of bacteria in her gut. She was suffering from insomnia. She had migraines. She had irregular periods, bad acne, and she was on hormones to try to regulate her period. And so the thing that struck me is that here is a young woman, 22, who has so many issues going on. And typically when we're young, that's when we're usually the healthiest. It's not till we get older that things start to wear out and break and break down. But in her case, it was shocking to see so many health issues. And so when we were doing the health history, and I dug a little deeper, what I realized is that she had grown up in a very traumatic environment. Her mother was an alcoholic for her childhood and for most of her adult life. And it had left a very big emotional scar on this young lady, and also a very big physical scar. And so the reason for that is when you live in the fight or flight or freeze response, which we call the autonomic nervous system, it's where your body is preparing to flee or to do battle. It's a very heightened state of being. But when you're in that state, what happens is that your regular digestive repair and maintenance, what we call rest and digest, which is the parasympathetic nervous system, that does not function. So one turns on and one shuts down. And in her case, she had been turned on for way too long that things started to break. They were stressed out. And so when she came to see me, it was just so apparent that she was still living in that state. And so what we did in clinic is, what I typically always do, is we do a very extensive health history. And then I will start to do acupuncture. And there are really great acupuncture points for calming the mind. And the biggest one is, it's right here between your eyes. It's called Stop Thought. It's called Yin Tong. And so we put that in, we put some needles in the forehead, some in the chest, because a lot of people hold anxiety in their chest, and some in the stomach and the hands and the wrist, because these ones here support the heart. And so the whole goal in these treatments is to get the patient to the point where they feel safe. They feel relaxed. And so I do the acupuncture, and once the needles are in, then I will start doing healing touch, because what we need to do is not only get the patient to calm, but we need to start to release that trapped energy. And the beautiful thing about Chinese medicine is it talks about energy specifically and where it gets stored in the body. And when you use needles and combined with healing touch, I find you can move energy more effectively and with more dramatic results. And so if you think of a balloon that's been blown up and you take a needle and you pop it, that's the emotional pain, and the needle pops that pain and releases it from the body. Once the pain is released from the body, then the body can start to heal itself. And so when you think of emotional pain, think of when you felt upset and you had this feeling in your throat and you could not swallow. We call that a verklempt feeling. That is qi, that's energy. It's invisible, but it's still physical, if that makes sense. And over time, if we fail to process our emotions, if we fail to feel things and release them, if we allow anger, resentment, frustration, disappointment to build up in our body, we will hold it. And what typically tends to happen is that energy needs to move. So it will go from the liver, which regulates the flow of the body, over to the spleen, stomach, which starts to weaken digestion. And then we start to see digestive disorders like a lot of bloating and food sensitivities. We see irregular bowel movements. Some people suffer from constipation, then diarrhea. It becomes a very recurring pattern. And in Chinese medicine, we call this liver qi stagnation, because the qi of the body is not flowing smoothly. And if left untreated, it becomes a bigger and bigger issue. And so trauma is one of those, let's call it illnesses, that if left untreated will start to affect pretty well every organ in the body. So trauma needs to be released from the body. And what we see is, and what I've seen in my practice, is people that have had traumatic environments will often turn to other substances to help them cope. They will try to placate those emotions rather than release those emotions. And so what happens over time, though, is you can only push emotions down for so long, and then the body starts to give out. And I had another example where a young gal had been raised in, again, a very abusive environment. Dad was an alcoholic and drug addict, and she eventually shut down herself. Like, she eventually shut down to the point where she had to be escorted off a ferry. Like, her body just stopped working. Other people have used marijuana and used it, and it was great. And then the marijuana stopped working, and then their anxiety became so incapacitating that they couldn't leave the house, they couldn't hold down a job, they couldn't cope with one more thing. And so if you are in this situation, or you know of somebody who's in this situation, the most important thing we can do is get them to a place where they feel safe. And so that means finding practitioners who can support them through this journey, because those emotions that have been pushed down, and those traumatic experiences that they felt that haven't been released from the body are being stored there. And so what I do is I create a safe place for people to come. We work with the energy in their body. We release it to a certain point where they can start to cope, right? So where they can go home and they can actually feel their feelings. They can feel how tired they are. They can feel how wrung out they are. And so my job is to get people to calm so the body can start to take over and perform its functions. And I find with the healing touch and the acupuncture combined, that creates a place for people just to let go with a lot of that trapped energy. Now, are people cured? No. I work in conjunction with a lot of counselors, a lot of people that do EMDR trauma counseling, because I feel that we store all of these events that happen to us. We don't want to, but it's human nature. And sometimes if the event is too traumatic, we will store it, we will repress it, we'll put it away somewhere. And then if something triggers it, it all comes back. And we see that in situations where we have what we call an overreaction to something, where it's just so painful. The chances are, if you followed that pain down, it was probably rooted in a childhood experience that got tripped up as you became an adult. And so if we don't feel these things and allow them to pass, then we hang on to them. And that's when we start to see health issues, anxiety, depression, panic attacks, gut disorders. In women, it'll often show up in really bad periods, irregular periods, skip periods. And so my message today is that if you are suffering from trauma, it's important to get help. It's important to seek out practitioners who can help you process this trauma in a safe way. And I think the human body is designed that we are able to take things on when we feel we're in a place where we can take them on. So we can't deal with something until we're ready to deal with it. And so if you are ready to deal with your trauma, I would encourage you to reach out and look into trauma counselors, look into cognitive behavior therapists. Acupuncturists are great people to help you move a lot of that trapped energy, that stuck energy, especially if you're holding it in your gut or in your chest. A lot of times we hold a lot of stress in our neck and shoulders. And so we work to release that energy, but I would also encourage you to work with a practitioner on an emotional level to help you let go of the emotional side of that. And so when you combine those two, it becomes a very powerful healing modality. And if you have any questions, please feel free to reach out to me. My website is julienelsonTCM.com, or you can contact me through chiintegratedhealth.com.